Okay, good morning, everyone, and welcome to today's webinar presentation on promoting health, a reintroduction to program planning. My name is Dan Johnson, and I'm an education specialist on the capacity building team at PHO, and I have the pleasure of moderating today's session. So before we begin with today's presentation, I'd like to mention a few housekeeping items. To enhance the presentation experience, participant audio and video has been disabled. The chat pod has been enabled to encourage discussion. Please use the Q&A pod if you have any questions during the session. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. So now it is my pleasure to introduce the speakers for today's presentation, Andrea Bodkin and Lisa Gallant. Andrea has worked in health promotion and public health since 2003. As a senior program specialist in health promotion with PHO, Andrea brings her enthusiasm and expertise for planning in all forms: evaluation, community engagement, partnership development, and facilitation to public health units across Ontario. Andrea holds a master's degree in public health with a specialty in health promotion from Deakin University in Melbourne, Australia. Lisa is a program specialist at Niagara Region Public Health. As part of this role, she is creating a robust planning, measurement, and evaluation plan for health promotion work that can improve health and health equity for Niagara residents. Lisa specializes in participatory health promotion planning, healthy public policies, and strengthening community action to influence environments that can have the greatest impact on fostering good health and well-being. She values the importance of health promoting initiatives and strengthening relationships with local partners to advance this work. I'm very excited to hear from both of them, and I'm going to pass things over to Andrea.
Thank you, Dan, for that introduction. I'm so excited to be here, and I'm really excited to have Lisa here as well. Lisa and I have worked together kind of formally and informally for about 15 years or so, I think, Lisa. So it's really great to kind of be back together again, and especially to talk about one of the things that we both get extremely excited about, which is planning health promotion programs. So as Dan mentioned, I'm Andrea Bodkin. I identify as a white cisgendered woman of settler heritage, and most of my ancestors came to this country from Europe in the 19th century and settled land in southwestern Ontario. And this means that I'm acutely aware of the privilege that I hold today is directly responsible to, or directly attributable to the decisions that my ancestors made when they first came to this country. And for that reason, not only am I doing land acknowledgements in the webinars and the workshops that I'm doing, but I'm also really taking a look at the content of what it is that I'm working with and presenting, and using a beautiful teaching called two-eyed seeing, where through one eye, I look at my settler and colonial past and also learnings and teachings, and with the other eye, I try to be aware of Indigenous ways of knowing and bring that to my work as much as I possibly can. Today I am speaking to you from my home in Takaranto in Toronto, beside the Wascotanash River. And this river is today known as the Don River, but has been home to Indigenous peoples for over 11,000 years. Most recently, this land has been in the care of the Mississaugas of the Credit, which are a band and a group of people who still exist today and live just outside of Hakersville, both on and off reserve. So today I'm going to talk a little bit about health promotion program planning. The whole point of this webinar series is that many of us health promoters have been away from our health promotion work for the past couple of years, working on COVID, myself included, and Lisa has been doing a lot of health promotion work and also working on COVID too. But we thought it would be a great idea to kind of reintroduce all of ourselves to what health promotion is and some of the different components of that, both for those of us who have been away and are coming back, and also maybe for people who are just learning about health promotion and want to learn a little bit more. So we're going to talk about what planning is, and in particular, how can we consider health equity and sustainability when we're planning our programs? And then Lisa is going to go through the 6 steps of PHO's program planning model using an example from her work at Niagara. And then we will have some time for questions and answers at the end. As Dan mentioned, we have a Q&A pod which you can use to ask us questions, and Lisa and I can answer throughout and using text, and then we will also answer questions out loud at the end of the presentation. So let's talk a little bit about what planning is, because this certainly isn't something that is individual to public health or even to health promotion. Basically, every time we plan a vacation, decide to buy an appliance, make any personal or professional decision, we are going through some kind of planning process. Really, what we're doing when we're planning is we're deciding what it is that we want to accomplish, how it is that we're going to accomplish that, and how we are going to know if we have accomplished it. There's lots of different ways to describe planning. We're basically making decisions, hopefully with groups of people on best available evidence, but really what we're doing is figuring out what our goal is and how it is that we want to get there. And the next slide, thank you. So planning is both an outcome and a process. And if you think about the outcome of planning, the outcome really is your plan, your document, whether it's a chart or a report or whatever that happens to be, a strategic plan, an operational plan, a work plan, a funding proposal. All of those pieces of paper or electronic documents are the outcome of your planning process. And we need to have that outcome, because if we don't know where it is that we're going to go, how are we going to know when we've gotten there? We might be lost in tributaries and all on the wrong side of town without that clear map, that clear sense of direction. But planning is also a process. If you can go back to the previous slide for a second, one of my favorite quotes is from Dwight Eisenhower, but I somehow always hear it in the voice of Winston Churchill. In preparing for battle, I have always found that plans are useless, but planning is indispensable. That speaks to the process, how valuable that planning process is. It's deciding how you're going to make decisions, what evidence you're going to collect and read, what you're going to learn about your community. It's the relationships that you are going to build. It's a sense of trust you're going to develop with your community. All of those are valuable assets that you get from the planning process, that even if your plans go up in smoke, say for instance, because of a global pandemic, what you have learned along the way, that process of planning is as valuable as the outcome, as the plan itself. Now we can move on to the next slide. So last week in the webinar, I talked briefly about what health promotion is. And this was a bit of a light bulb moment for me when I read a terrific paper from 2014 by Susan Carter that talked about health promotion as a normative ideal and as a practice. So a normative ideal, it's kind of like a vision that the Ottawa Charter gives us, that health promotion is the process of enabling people to increase control over and to improve their health and their determinants of health. It's really a vision of what society can be, that is equitable, that is fair, where everyone has access to what they need in order to become healthy. As a practice, if you click twice, Karina, health promotion is any planned combination of educational, political, regulatory, or organizational supports that are geared towards the actions and conditions of living conducive to the health of individuals, groups, and communities. So as a practice, we have a huge group of people, some who may identify as health promoters and others who may not, people in social services, people in active transportation, people who work in policy and planning, all kinds of different folks and communities working together through these concrete actions geared to improving health. And on the next slide, before we start talking about these these programs improving health, we need to have a sense of what it is that we are actually trying to improve, because health is more than a series of behavior, and health is more than access to healthcare or to a particular service. In Canada, we recognize 12 social determinants of health, and we recognize that about 50% of our health is influenced by these social determinants. Do we have well-paying work and safe housing? Do we have access to a safe physical environment? Were our childhood experiences damaging to us, or did we grow up in a healthful environment? Are we impacted by colonialism or racism or marginalization? These are the structures that impact health. Therefore, when we're planning our health promotion programs to improve health, we need to have these factors in mind. Next slide. So health inequities refer to the differences in health between groups of people that are systematic, unfair, unjust, and avoidable. In other words, those determinants that we just looked at aren't always equally distributed. Not everyone has access to them. Health equity, on the other hand, means that everyone can reach their full health potential without disadvantage due to social position or another socially determined circumstance. There's a little bit of that normative ideal again, that vision of what our society can be when we plan our health promotion programs with equity in mind. The next slide. So how do we plan our health promotion programs with equity in mind? So there's a few different models you can think about. You're probably all pretty familiar with the universal model, which means that we have programs and services and initiatives that are openly access to everyone. Everyone in the universe has access to these programs, regardless of where they live, work, play, and what access to those services they happen to have. Now, this approach does not recognize that not everyone does have that same access. Not everyone does have those same resources or those same needs. So another approach we can think about is a targeted one. Now, this is a slightly militaristic term, so please keep that in mind. I tend to soften my language a little bit. And these approaches are when we gear or customize our programs or services towards groups of people who need that in particular. Perhaps it's a group of people that have been very marginalized or have a social determinant of health that particularly affects them. And this particular approach recognizes that some people need different accesses, different resources than the rest of the population may. Now, there's two types of programs in particular that can help us address equity. One is called proportionate universalism, and this kind of combines universal and targeted. So we might have a universal program that everybody has access to, and then there may be a population or a community or two that might need particular access, like I just talked about. They may have differences in accesses or resources or something like that. So maybe we have a universal program, and then perhaps we have lower costs or fees for geared to income for people who have lower incomes, etc. And then the last one, this one's a bit tricky. Targeted within universalism recognizes that there just isn't one big group of people with separate groups within it, like proportionate universalism. Targeted within universalism recognizes the gradient of health. And so with these kinds of approaches, we might see a range of different services, of different initiatives, of different programs that recognizes that every person has slightly different needs. So once we have determined what it is we're trying to achieve our goal, once we have considered what is actually impacting the health of the community that we're trying to reach, we've got one more big question on the next slide, and that is, are our programs going to last? I don't know about you, but I've been in this field long enough that I have seen a lot of programs come and go, and I have worked on a lot of programs that have come and gone. The vast majority of the programs that we work on, that we experience, that are funded, do not last beyond their initial funding packet. And that means that they can actually deliver the benefits that we're hoping that they are going to benefit. That means that the relationships that we've built, the trust that we've built, the assets that we have fostered, all of those things can end, not to mention the health behavior or the health change that we actually developed the program to actually change. So a couple of years ago, I did a systematic review along with a co-author, Sean Hakimi, and we just got super interested in how can we actually develop our programs so that they have a better chance of lasting beyond their initial funding packet. And on the next slide, we're going to see 14 factors that can promote program sustainability. And what I get real excited about with this list, especially because I love program planning so much, is that if you look at this list, you can see that a lot of these things can actually be considered when we're developing our programs. So for example, organizational capacity, the number one thing on the list. Does your organization have the capacity to implement this program? Do you have the staffing? Do you have the resources? Do you have the space or the infrastructure? Do you have the relationships? Do you have everything that you need to actually implement that program fully? If you do not, that's going to impact the sustainability chances of your program. Do you have fit and alignment between the mandate and the vision of your organization and the mandate and the vision of the program that you're talking about? If you don't have that fit and alignment, it's going to be pretty difficult for you to advocate to your organization, to your board, to your funders that that program needs to continue, because there's a bit of a mismatch. Do you have a program champion, or preferably more than one? Somebody influential, somebody with a vision of the community that can actually say to people, not only is this program awesome and you should implement it, but you should sustain it. And then I brushed over number 2 on the list, which is partnerships. Do you have those relationships with other organizations or with the community in order to be able to keep your programs going? So an example I love to bring up here from a previous agency in the beginning stages of my career, Go Girls, Healthy Bodies, Healthy Minds, which was a provincial program implemented by OFIA, Boys and Girls Club of Ontario, and Parks and Recreation Ontario. And it was a program for youth who identify as girls from 12 to 14 years of age, really aimed to give them some confidence and some skills around healthy eating and physical activity. And OFIA knew right from the beginning that they didn't have the capacity to implement this program beyond the development phase, beyond the research phase. And so they very deliberately partnered with organizations that might be able to continue the program on. Now, I started with that program in 2004, and today in 2022, Boys and Girls Club of Canada is still delivering Go Girls. They have been able to sustain that program for all of these years. And part of what happened there was recognizing the organizational capacity need, having the partnerships, and having the fit and the alignment with Boys and Girls Clubs of Canada so that program could continue. So just a little example of how you can actually build your programs with sustainability in mind. So on the next slide, you're going to see Public Health Ontario 6 steps to planning health promotion programs. Now, there are many different program planning models, as many as there are people, sometimes I feel like. And while they may have different numbers of steps, and the steps may be called different things, what they all have in common is, what is it we want to accomplish? How are we going to accomplish it? And how are we going to know when we have accomplished it? That's what these 6 steps are really getting you to do. They're getting you to think about the planning process itself, who is going to be involved, how are we going to make decisions, how much money do we have to develop this program. They're going to help you look at the environment, the situation around you, and help you think about what is making this, what is the situation, what is making the situation better or worse, and what can we do about the situation. Then you can set your goals. Like, what is it I want to accomplish? You're going to define your audience and the objectives of what it is you're trying to do. You'll choose strategies and activities that will help you get there. You're going to develop some evaluation stuff to help you know what you have accomplished and that you can measure it. And you're going to review your program plan. That's a nutshell version. And rather than torture you by me listing out the 6 steps, we're going to pass it over to Lisa to really illustrate from a practical perspective what those steps can look like in real life. Just before Lisa dives in, I've given you a lot of information. So on the next slide, I want to just outline 3 key messages that I have. And Karina, they're animated, so please feel free to just click them all onto the screen there. Oh, go back. There we go. Thank you. So like I mentioned, I've given you lots to think about. So here are the 3 things I'm really hoping you're going to take away from my wild avalanche of words that I've given you this morning. The first is to plan your programs using an evidence-based program planning model, whether that's PHOs or any of the other ones out there. Having a planning model is going to make sure that you're considering everything that you need to build your program. Consider how you can best address health inequities through your program. Either address them directly or at the very least make sure you're not exacerbating any existing health inequities. And then my 3rd key message is to plan with sustainability in mind. Resist the temptation to think within the framework of your funding packet and try to think long term. What can we accomplish with this program in the long term? So on the next slide, you'll see my references. And when you do get access to these slides in a couple of weeks, you'll be able to look all of those up. And now I believe I'm going to pass it over to Lisa. Thanks so much for being here, Lisa.
Thank you so much for having me, Andrea. It's great to be with everyone. I am joining you from Niagara. Niagara Region is situated on treaty land. The land is steeped in the rich history of the First Nations, such as the Hattawandurok, the Haudenosaunee, and the Anishinaabe, including the Mississaugas of the Credit First Nation. There are many First Nations, Métis, and Inuit peoples from across Turtle Island that live and work in Niagara today. The Regional Municipality of Niagara, where I work, stands with all Indigenous peoples, past and present, in promoting the wise stewardship of the lands on which we serve. So I am thrilled to be with you today. Andrea has asked me to animate the 6 steps of Public Health Ontario's planning process. And I thought, what better way to do that with a program that is near and dear to my heart called Active School Travel. This is a program that's designed to make it easier and safer for more students to walk, bike, and bus to school. So I'm going to dive into the first step here, managing the planning process. So the start here for you is to make sure you have a conversation in your organization about that model, what that means for your planning cycle, what are the tools that you'll need to have in place. And it's great to have tools available to us from PHO as well to help inform, give us a better understanding of some of those pieces within the planning and evaluation framework. In Niagara, actually, we're working on formalizing this process. So at the time where I was doing this planning with Active School Travel, and I must say too, throughout the duration of Active School Travel, I've used PHO's 6 steps at the very beginning when we were just piloting the program to see if it would work here in Niagara, to further on in the process, which was recently, which is the one I'm going to just talk about, where we had a funding opportunity and we were looking at how we could institutionalize the program for better sustainability. And right now I'm working with public health, and we've been working through a process called evidence-informed decision-making based on NCCMT's tools. And so that's another planning model that you might be looking at within your organization. So once you have this understanding of the expectations, you're also going to be looking through the reason why you're doing this planning process. In this case, I mentioned we were looking at institutionalizing the program for better sustainability. We already had decisions that were made with Active School Travel around the audience that we were going to use, how we were making decisions. The program is actually co-led between 2 organizations, Public Health and Niagara Student Transportation Services, which is the transportation consortium for both of our school boards. So we had very clear decision-making model in place and accountability that was in place through this partnership that we had. And I mentioned that we had a funding opportunity here, and through the funder, we had very clear tools that we needed to use, and the timelines were already set out for us. So if we go to the next slide, I'm going to spend a little bit more time within step 1 here, getting into who needs to be involved in your planning process. And before I go into detail with this slide, I'm going to take just a little bit of a pause to talk about the importance of words. As you're going through your program planning process, you're going to come across many tools that reference the word stakeholder. The graphic image in this slide, for example, is called a stakeholder wheel. And in planning, we use those tools to help us consider people or groups or organizations who are interested in or affected by the work that we're undertaking. So I have recently learned that there's a negative historical reference to this word stakeholder. It dates back to the colonization of the lands that we now refer to as Canada, where settlers would put stakes into the land that they wanted to own. The stakes would be mapped, and those settlers would be given full decision-making power on the use of the lands. They would become essentially the stakeholders. This understanding of land ownership does not align with Indigenous ways, and when the land was taken from First Nations, it took away their place in decision-making. So at Niagara Region, we're working on no longer using that term. And it's a small thing, but acknowledges the need to right this long-standing injustice as part of reconciliation efforts. So I just wanted to mention that before going through this tool in detail, and just encourage you to consider to have that conversation in your organization if you haven't already about the use of this term. And as you're Googling for more information about doing this type of work, just to be aware of the use of that term. So to get into more detail then, I wanted to talk about who needs to be involved in your planning process. In Niagara, at the core of our program, we have 2 organizations who co-lead and partner very closely on this work, Niagara Region Public Health and Niagara Student Transportation Services. Involved, we had an advisory committee, and they were very involved in helping us work through our commitment to the program. They included people like superintendents from both school boards, facility managers, engaged principals, managers from public health, police services. So these are people who needed to be involved very closely within our planning process. And then you can see, you look further on, who are the people who can support you in this work that you need to reach out to, and who are the people who may not be wanting to be contacted in an ongoing in a detailed way, but they're your champions who you want to bring along as you're going through this planning process to keep them informed of where you're at and perhaps get some information to help inform your planning. So next slide. We are ready after this to jump into step 2, the situational assessment. And here you really just want to get a sense of what is happening with your issue. What do you know? What is making the situation better or worse? And what actions could you take? In our case, we had great population level data that talked about school travel trends. We have our national data that talks about physical activity rates, and we know how dismal those rates are. And we'd also been really fortunate in Niagara to work with groups and people who have a vested interest in advancing active travel in general. And we've been able to bring them together over the years to have conversations about their interest in this area and things that we can do to advance this work. So those are things that we knew, and this is where we could go for some of our data. When you're looking at what's making the situation better or worse, in Niagara, we looked to local surveys that we had access to. We were asking parents about things that made it hard for them to walk or bike to school. And, you know, there are about 5 things that parents kept telling us over and over again. You could probably guess what many of those things are. And that was validated by national data as well. So we had a really good sense about the barriers to the walk to school. We'd also done a review of policies that hinder or encourage active travel. A really great thing to look at in your communities, especially if you're doing work that hinges on policies that can make a difference. And another piece that I'm going to talk about a little bit more too is doing a SWOT and PESTLE analysis to look at the strengths, weaknesses, opportunities, and threats, and also to look at it within a lens of, you know, from politics, from environment, social technology, and all of those things that PESTLE stands for in its acronym. And then the last thing of that situational assessment, when you're done it, you want to have a really good sense of what actions you could take. For us, we already knew some of the best practice. We have rapid reviews. There's a great one that had been done by PHO. Ontario Active School Travel houses that information for us. And recently in Niagara, we've just completed a rapid review as well that validates our active transportation work. We knew that as part of this part of our planning, we wanted to reconfirm commitments of lead groups. That was a very important thing for us to do in sustaining the program. And we wanted to do a better job of documenting some of the school information. So the next slide, I wanted to share a little bit more with you about some of the things you might see when you do a SWOT or PESTLE analysis. And what's great in the work that I'm doing in Niagara, there's actually two of us working on the active transportation portfolio. Jackie Gervais and I, every 5 years, will renew a strategic plan for active transportation. And we've used this tool in this work to have a better sense of what are the strengths, weaknesses, opportunities, and threats. And in bold, I've put for you some of the things that emerged as we looked at this from PESTLE, from the political, economic, social, technological, environmental, and legal factors. And these are just like a few examples from each of those boxes, so you can have a sense of what might come up through your analysis. I think in total we had about a 2 or 3 page document that listed all of these things. And what I want to point out for you too is that this could be a very quick internal exercise that you do yourself, maybe with a couple of colleagues. But the real value is when you start to have this conversation with people external to your organization as well, to better inform all of these pieces that you will want to look out for when you're getting into creating your plan. The last round that Jackie and I did, we know with the pandemic that people are very stretched, and we knew that we couldn't bring people together to have this conversation. Because we have really great relationships with our partners, we were able to send an email out to about 20 external groups and just ask them, you know, what's going really well in active transportation right now? What are some things that we should have on our radar that we need to strengthen? Where are some opportunities that we could take advantage of as well? So those are some of the things that you can look at within this part of your analysis. And then we'll move to the next slide, where at the end of your situation analysis, you're going to end up with a 1-page document. It could be in paragraph, sentence format, or in bullet points. But it's going to summarize the situation in your area for the topic that you're looking at. It's going to pull together all the research that you did, who you've talked to, what you understand about the situation, and the last bullet will really get into what you believe from your organization you can do to make a difference. And these are things, when I talked about that engagement wheel earlier, even people on the periphery, this is the type of information you want to share with them. You want to share it with everyone so you're all on the same page, and you have some good quality information to share about the situation you're working on. So the next slide, we'll get into step 3, where you're getting into your goals, audience, and objectives. Now, one thing about active school travel is actually a program within a program. So the goal that I've shown you here is actually taken from our active transportation work. The audiences are already very clear for us for active school travel. And what was new for us in this planning phase are these outcome objectives, where we wanted to institutionalize the program and we wanted to further grow the program. In the next slide, we get into step 4, where you're actually starting to create your plan. You're choosing your strategies, activities, and assigning resources to it. So as far as strategies go, this comes back to the expectations of your organization. What are the models that your organization expects you to create your plan based on? And for us in Niagara, we look at the Ottawa Charter and Health Impact Pyramid. And I included a couple of bullets here for things related to the Ottawa Charter that really align with our work in active school travel. And for those of you not familiar with Health Impact Pyramid, I have an image here. And you can see that as you get to the bottom of the pyramid, you're looking at more of a population impact. And in our active transportation work, we really stay on the bottom end of this pyramid, where we're trying to change environments and the context in which people make decisions about being active, and also social and economic factors. And this is where you'll have your conversations related to health equity and how that relates to the program you're working on. So once you have those strategies in mind, we'll go to the next slide. And likely you're going to be brainstorming an incredible list of activities based on some of the look that you've had with best practice, based on how when you've talked to people about the type of work that needs to happen to advance your work. You're going to have a long list of these activities, and you may only have a certain amount of time and resources, so you'll need to start to prioritize. And this is where you can look back to your strategies and see which activities best align with the work that you're trying to do within those strategies, and perhaps within health equity as well, activities that better relate to what you're trying to do with health equity. In the next slide, once you've chosen those activities, you're going to come up with your objectives. So we already have our outcome objectives. You're going to develop process objectives. And the really important thing that you need to focus on here are your indicators. At the end of the day, how will you know that you're successful? This is going to be the start of your evaluation plan. And we always talk about planning for evaluation before you're implementing your plan. So it's an important area to spend a lot of time on. And I really encourage you to have a conversation about quality measures. So we're very good at creating outputs, but what are the qualities behind those measures? So we could look at number of meetings, for example, but what was really important to us in this work at the end of the day was the agreements that we wanted in place. And knowing we had those agreements would strengthen the ability of this program to be sustained. And at the end of the day, is anyone better off? And for us, that measure was looking at percentage of students who indicate they walk, bike, or bus to school. Now, sometimes we don't have the data. We were really fortunate in Niagara with our program. We're able to go into classrooms and do classroom count data to see if there's a change in the number of students who report walking, biking, busing to school. But sometimes this might have to become part of a data development agenda to see if you can actually collect this data and how you will, and that will become part of your evaluation plan. So our next slide, we are ready to move on to step 6. So you have all of these things that you've put together in your plan, and now you want to check the logic of it. The model that I've shown here for you is the format that we use in Niagara. There are lots of different formats that logic models can take. In Public Health Ontario, if you go into their guide related to program planning, you'll see 2 sample logic models that they are referencing as well. The point here is that you're checking the logic. So you've got your goal objectives all the way through to your indicators, and you want to make sure whatever you're measuring at the end of the day is going to be related to activities that you've set out, and is at the end of the day going to help you with your goal. So again, it's more about the logic. After you've got this in place, you're still going to be working on a program plan that captures details for your activities of who's going to do the work, by when, what are the resources that you have attached to it. You're probably going to use this to create an evaluation plan to make sure that you have people on board to look at collecting the indicators, and again, by when, and perhaps even a communication plan of how you're reaching out to people who you identified earlier on that wheel. And we'll have done more work on identifying through the implementation to keep them engaged as you hit milestones with your program. So that is the end of those 6 steps. And my last slide is just a thank you slide to you with another picture of Blue the butterfly, who we've used within our pedestrian safety education through some funding that we just gotten from Ontario After School Travel led by a couple of our municipalities in Niagara Falls and Fort Erie. So thank you so much for the opportunity to share this information, and I'll turn it over to you, Andrea.
Thank you, Lisa, so much for that. What I loved about your example is that while, of course, you were talking about active transportation, because that's the example that you used, but you really used that to go through the 6 steps so that anyone, regardless of what kind of planning you were doing, could actually follow along and see the steps that you have outlined. So I just wanted to say thank you so much for making it so transferable and interesting. I've posted a lot of resources in the chat as you were talking, Lisa, and so we'll make sure that those are included in the handout slides.
Perfect. Thank you for doing that.
Great. Thanks, Lisa and Andrea. I grew up in Niagara, so in my mind, I was just thinking about Highway 3 and all the schools that are built on Garrison Road and how impossible it is to cross the street to get to them. So that was kind of my reflection as you were talking. And at this point, we're moving into the Q&A section. So there is a Q&A pod if people want to submit questions in there. that's where you can do that, and we will go through them as they come in, either we'll discuss them out loud or we'll answer them by text if that's easier. And a question that I had for both of you to kind of get started is thinking about, now that we're in this post-COVID stage of planning and moving on and thinking about health promotion again, is between the SWOT and PESTLE analysis tools and methods, do you think that what one would capture best, in your opinion, changes related to COVID? So whether that's people are doing things in a different way, or there's a new policy, or those kind of things. So I was just kind of curious about your thoughts on how we would adapt these tools to this post-COVID world.
I could jump into that because the SWOT and PESTLE that I had shared with you was actually done during pandemic. It was just done last year. And some of the things we flagged within that were there was dialogue that people were seeing more people being active, that there was actually an opportunity, since families were working at home, that they had time in the morning, and this issue of convenience wasn't as much a barrier to walking, biking, busing to school. But the other piece that was flagged was there was a lot of speeding, a lot of stunt driving, it's called. So our engineering friends were flagging that for us as an issue in terms of some of the use of the road. When we were doing our review through the evidence-informed decision-making process, that also came up during some of the recommendations that we were looking at when we were looking at the context locally. The results from COVID have come up over and over again, and there's some things we just don't know the answers for yet, but it was flagged as something for us to look in further research needed to better understand how the pandemic has impacted people's behaviors, how it's affected mental health, how it's affected substance use, all of those factors. And we know that, chronic diseases are going to be significantly impacted as a result of what we've seen with the pandemic. So definitely would come up within that analysis. And as we move into election year too, what are our elected officials going to be talking about within our municipalities? Where is their support within this work? So good questions to be asking as individuals in your community.
Great, Andrea. Anything to add from your perspective?
No, thank you, Lisa, for that great answer, because that was a killer question, Dan.
Thought I'd start off with a real tough one, but here's another one for you, Lisa. Can you explain a little bit about how you considered health equity when you were making these active transportation plans in Niagara? How did that kind of factor in?
Yeah, so it's a really good question. It comes up often in terms of the schools that we select. So in working with Niagara Student Transportation Services, ultimately they will choose the schools that we go into because they have the relationships with the principals and know the capacities within the schools. But one of the things we look at are the neighborhoods those schools are at. And it's interesting because if we look at rates of walking to school, for example, it's often in the neighborhoods where there is a lower socioeconomic status, where we see more kids walking, which is wonderful. But again, it's also in some of those neighborhoods where there hasn't been a lot of advocacy for infrastructure changes. So we want to make sure we're going into those schools and looking very carefully with our friends from engineering and from the school to look at the walk zones that the children are taking and to make sure that we can make them as safe as possible. And then in working with the principal, they know how their school operates, they know how engaged parents are, and they know the types of activities that they could work towards to encourage more walking and cycling. So that's one way that we're looking at health equity, and in terms of prioritizing some of those schools who really need that support as well.
Great, thank you for that. Let's talk about theory of change and how that can kind of factor into this. So in terms of planning and evaluation success, what do you think about theory of change resources, or how would you incorporate that into the program planning work? I don't know, Andrea, if you want to start with this one, and Lisa, you can.
Yeah, I can, and then I'll hand it over to Lisa. So theory of change, just for those of whom aren't familiar, is basically the underlying logic behind your program. So if you do A and you add in B, does that equal C? So that's a very simplistic definition, but basically identifying how you feel that change is going to be made. I'm so lucky to have a student with me for the summer, an MPH student, and she is currently working on a literature review on theories, models, and frameworks, and she has identified some theories that are often used in health promotion, and we hope to be presenting that research to you all in the fall. But really, I think the logic model can help you do that and make sure that the activities that you have planned are in alignment with your goal, and that you have those indicators and outcomes that are going to basically complete that logic between your goal, your activities, and your outcomes and your indicators. So I hope I don't know if I answered that question. So I'm going to pass it over to Lisa, because maybe you have a better way to answer it than me.
No, I think that was great, Andrea. And referring back to the logic model definitely makes sense, because that's the whole point of it, is the logic there in terms of where you want to get with your goal and the activities that you're looking to do. And I'm glad you brought up the idea of theory as well, Dan, because even within the planning phase, you may want to look at a certain other theories too, that it can inform your planning. So when we were looking at our work with active school travel, for example, and I'd be curious to know in the chat if people, other theories that people are looking at within their work and things that have really resonated. But we've looked at looking at early adopters, who are the early adopters who take on some of this work? And for us, looking within the school boards too, who are our champions, and how many champions will we need to have in order to get to a tipping point of change, to bring on other people to say, this is a good program, this is a program that is worth sustaining and institutionalizing within our school boards, which is a stage that we're at right now. We have that support from our school boards in terms of seeing that value. So, looking at those theories to guide you in some of that decision making too is very helpful.
I think
Sorry, the theory was diffusion of innovations. I should have mentioned that too.
Sure. I was also thinking about just how much time the planning phase can take. I don't know if that was something that people are, like, lots of questions are coming in around, like, did you have an idea when you started planning, or did you think about things like health equity impact assessment or privacy impact? Like, these are big things to consider, and they take a significant amount of time to even get to that logic model. There's many steps involved and many things to consider. Do you want to unpack those ideas a little bit, or kind of just, even with your case example, kind of reflect on how long it took to kind of get to that fully developed logic model?
Yeah, step one, that managing the process, that can be the kicker, right? I mean, you really want to test out all of your assumptions. However, there's also this balance of paralysis by analysis. I've had a colleague term that, right? Where if you spend too much time and you're just waiting to get it perfect, you won't be ready to move on to the next steps. And the lovely thing with planning too is, as you move forward with different steps, there may be things that you weren't apparent to you before, but you can go back and look at that more closely. As you work with more external folks, they may identify other people who you never thought to speak with. And so you can go back and engage them as well. So it's a process that it doesn't have to follow those 6 steps purely. You can go back and forth within it. And the real message there is don't get paralyzed in one step. Keep moving forward within it. We were really fortunate when we went through this last phase of the planning. We'd already gone through this a couple of times before. And so we had a really good sense of all the players. We had a sense of some of the needs. We had a lot of data at our hands. So fabulous when you can have that relationship with your epidemiologist, data analyst, to help you understand, use that as part of your situational assessment to understand the data. Check out other resources. What other health departments have done rapid reviews? They may have done something right on the topic area you're looking at, and some of this work may already be available to you. So reach out to people and glean off of existing resources as much as you can.
That was actually a question in the chat. Like, your rapid review, is that something that could be shared, or can folks find more information about on Niagara's website?
I'll send something to Andrea about that. I have to look into where we're at within. We've just finished step 5 within the evidence-informed decision-making tool, where we've come up with the research findings and the recommendations from it. So right now it's an internal document for us to use. So I'll follow up with Andrea about that.
Great. Andrea, did you want to kind of mention anything else or elaborate on that last question?
I'm just going to jump in on the stuckness and also the circularity of program planning. And it gets very what I call chicken and eggy. So the whole which comes first, the chicken or the egg. And those 6 steps, I mean, in PHO's planning model, it looks very linear, but it is absolutely not linear, even a little tiny bit, because you do have to kind of go back and forth as you are developing your program. And in particular, when you're checking your logic in step 6, you may discover that you've got a break in your logic, that your underlying theory isn't going to actually provide the results that you're looking for. So I would just say be prepared for that circularity, and that's okay. And I would also just pick up on, Lisa, what you talked about in a comment in the chat, that it is actually extremely normal to get stuck and to get paralyzed. And that's okay. And pick yourself up and keep plugging forward. We could spend all of our time planning, and part of me would love to do that, but you've got to find that balance between having things planned out and implementation and evaluation and all of the other things that come up after you've designed your program.
And are you going to send a resource for the chicken and eggy theory of program planning?
No.
Haven't come across it in my academic studies, but
yeah, I think that's an Andrea-ism. That things get very chicken and eggy. Yeah. And just to throw in another Andrea-ism, that eventually you have to concretize your program planning steps. So it needs to be concrete as well as fluid.
Clearly it does. A question's come in about kind of more details around active school travel for rural schools. So I guess this would kind of come into like factoring in things when you're planning and creating your program, but if there's like no sidewalks or students that live close to a school, do you have any suggestions for active school travel planning for rural schools? They often get overlooked, or things are a bit different.
Yeah, it depends on the neighborhood. And Dan, you mentioned that Highway 3 through Fort Erie, right?
Yeah,
and
yeah.
We're really fortunate to have great relationships with our transportation engineers. And in Niagara, we're working towards something called Vision Zero, which is towards zero fatalities and serious injuries from collisions. And with that, we have community safety zones, which increase fines for speeding in certain areas, like that lovely Highway 3. And down the road, automated speed enforcement is becoming a reality here for Niagara. So sometimes it's about looking at the speed, it's about looking at the neighborhood always. In some of our rural areas in Niagara, we're working with planning, and we can identify areas where they're planning some growth and development with neighborhoods that are close to schools who typically didn't have a walk zone attached to it. And most of those students were bused to those schools. And so there's looking at the growth and development within your rural areas too, to see if there's opportunities to discuss as road reconstruction happens between those neighborhoods, and some potential connectivity. And it's also, in some of those schools, they're heavily bused. And that's for a reason, because there isn't a walk zone because of where they are. Some of our messaging is about taking the bus. Walk to your bus stop, right? Let's not be driven to the bus stop, which sometimes happens too, but walk to the bus stop. And so the message changes a little bit depending on the context of that neighborhood.
Great. Yeah, for sure. Last question. It's kind of a big one, but it's kind of thinking about how do you take it all and make that plan? So how do you balance the evidence-informed decision-making, planning with a lack of evidence, while also doing environmental scans and lit review? So for someone that's kind of newer in their role or just getting started, What are some recommendations for that?
So can you repeat again where
Sure.
the challenge is?
Balancing everything. So balancing evidence-informed decision-making, planning with a lack of evidence, so maybe a newer field in public health, while trying to also do environmental scans and lit reviews. So again, like maybe not a lot of evidence really out there.
Yeah. So, I mean, if you look through the tools from NCC and NCCMT, they'll help you come up with a question. They'll help you come up with a question to explore, and you need to have a very specific question, or you can have tons of literature come up. Some cases you go through that and there isn't a lot of literature, so maybe you have to do a deeper dive into some of the gray literature perhaps. Maybe you're looking at working with your community members to see what they've thought about this issue, and you're going to test out some things in your area because you don't have the literature really telling you one way or another. So you're going to look at the context within your community, what the needs are, what the opportunities are, and try something in terms of your planning. Maybe your plan is going to be about a specific activity and having an evaluation plan attached to that and learning more about the situation that way.
Yeah, just to jump on that point, just because there isn't evidence, because there is often not evidence, doesn't mean that you shouldn't try something. But what I'd really encourage folks to do is try it and measure it to see, does your underlying theory of change, does your logic hold? Are you actually getting the results that you think that you are? We often don't have the resources and the time in health promotion to actually analyze, evaluate, publish, and we really need to do that so that other people can learn and not be as hampered by that lack of evidence.
It's expectations within your organization too. Are you allowed to do big research? Or are they saying, if there isn't that evidence, where are we spending all of our resources? Are there topics that we're working on that is a priority? So it's part of that expectations within the organization still. What are your priorities and how would you move forward if you don't have the evidence?
Great. Andrea, over to you as we wrap up real quick.
Yeah, great question. So this is the second in a series of 3 webinars. The promotion for the third webinar is coming out today, and it is next Wednesday, and it is on evaluating health promotion programs.
Wonderful. Thank you so much, Andrea and Lisa, for presenting. Thanks everyone for your questions and participation. It's always great to see that. You'll be receiving a brief and anonymous survey for today's session. Please try to complete it to help improve our programming, especially since next week is on evaluation. Wouldn't it be wonderful if we had 100% response rate? For more information, you can visit PHO's website. And thanks again, everyone. Enjoy the rest of your Monday and have a great day and week. See you soon.